All right, chapter 14, bleeding, shock, soft tissue injuries. We're getting into some trauma now of our EMR class. So let's get started. So intro, EMRs, that's what we're striving for, right? One of the things we need to be able to do is recognize and then care for those patients who are suffering from shock and bleeding and soft tissue injuries. That's something we may run into quite a bit out in the field, depending upon kind of what you're doing and where you're at. And that's something that we can have a pretty positive impact on if we do things properly. So, some of the really important parts, we've got to adhere to some standard precautions when we're caring for these patients with soft tissue injuries. So damage to the internal soft tissues and organs, all that can cause life-threatening conditions. And internal bleeding causes patients to lose blood in the circulatory system and results in shock. So shock, we're going to use that word a lot throughout this program. Shock is a state of collapse of cardiovascular system that results in inadequate delivery of blood to the organs. So more trauma patients die from shock than any other condition. So we need to be able to recognize that and know what the thing is we're going to do for that. So also we're going to learn how to gauge the extent and depth of burns, and then we're going to understand their causes as well, all within this whole one chapter. So patient assessment, nothing changes, still all the same stuff, right? We're still doing the same thing. So trauma patients, we're going to perform the secondary assessment before obtaining a sample history. That's one slight difference that you might notice. But we're going to follow the steps of the patient assessment sequence when caring for these patients who are bleeding or in shock, have soft tissue injuries, kind of the stuff that we're talking about now. So scene size up needs to include all the steps that we've learned previously to ensure safety for us and for our patients, and obviously for the rest of everybody else on scene. So when you're performing this primary assessment, you may need to temporarily halt assessment if patient is losing a significant amount of blood. You may need to go to work on that immediately and, stop what you're doing right there and start shutting that down. So during secondary assessment, we need to be alert for any signs and symptoms of shock from internal or external blood loss. So, what we did with our primary is we were able to stop the bleeding. And in secondary, we need to think about, how much blood they lost. Are we noticing some level of consciousness changes? Are we noticing some skin color changes, some vital sign changes? Those kind of things. So when we're getting that sample history, we need to hopefully try to find out if this patient is using a blood thinner. Because if they are, that interferes with blood clotting, and that's the body's natural way of shutting down lacerations and abrasions and all of that stuff. All of those ways that the body loses blood. So for trauma patients, usually perform secondary assessment before you obtain the sample history. Now, when we're performing a reassessment, we want to watch the patient for the following signs and symptoms of shock. And we just mentioned that: pale skin, increasing pulse rate, decreasing blood pressure. So if you start to see some of these things, especially like decreasing blood pressure, that's really bad because that's kind of more along the lines of more of a late stage kind of finding. So you want to be pretty thoughtful that this person is pretty sick and they really need to get going. Now, standard precautions in soft tissue injury. So, the concept of standard precautions, all of that assumes that all body fluids are potentially infectious. If I haven't said it yet, I'll say it now. We treat every single person like they're sick. And then in the event that we run into somebody that is, we'll be prepared. So what I mean by that is we're going to have gloves on all the time. We're going to do the right things all the time. And then the time that we get our hand covered up in blood, we've got gloves on, so that's not a big deal. So we need to make sure that we are taking appropriate measures to prevent contact with these body fluids, because that's how we end up taking stuff home from these scenes, because they get, something was contracted. So we need to make sure that we're wearing gloves to prevent the contact with the patient's blood is what we're talking about. So at times, now you may need to wear a mask or eye protection, if there's danger of blood splatter, or if the patient is coughing or vomiting bloody material. You want to be, You want to be prepared for this kind of stuff. And then in the context of the pandemic, consider the need to protect against airborne or aerosolized infectious threats as well. Now, the circulatory system. So when we're talking about the heart, the arteries, the veins, the capillaries, all of that. At the center of the system is the heart, which pumps the blood. That's what we've talked about before, would be the pump. This is going to be the pump. Obviously, these are the pipes, and then everything that flows through there will be our blood. So the pump functions as a human circulatory system's pump. We've mentioned this before, I believe, when we did the A&P portion, anatomy and physiology portion. The heart consists of 4 separate chambers. So you have 2 upper chambers on the top of the heart. They're the left and the right atria. The atria are somewhat less muscular than the ventricles because they don't have to push all the way out to the body, push everything out systemically, so that it doesn't require near as much force. These things, they serve as reservoirs for the blood flowing into the heart from the body and the lungs. Now the 2 lower chambers on the bottom of the heart, those are the left and the right ventricles. And the ventricles are larger and do most of the actual pumping. So you see here where we're talking about the ventricles. And if you notice, when you look here, you can see that this left ventricle is thicker than this right ventricle. That's completely normal because this left ventricle is pumping out to the body. It's having to support the systemic circulation. So now, parts and functions of the circulatory system. So the pipes. Human body has 3 main types of blood vessels. So the arteries, they carry the blood away from the heart. Capillaries, smallest of the blood vessels, form a network that distributes blood to all parts of the body. And then the veins return blood from the capillaries to the heart, where it's pumped to the lungs. So blood enters an organ or tissue through the arteries, and then it leaves through the veins. Now the fluid, we mentioned that. We've talked about the pump. We've talked about the pipes. Now we'll talk about the fluid. It consists of blood cells and other blood components. So the liquid part of the blood is plasma. Plasma it does several things, but it's a transporting medium for the solid parts of the blood. So, red blood cells, they carry oxygen and carbon dioxide. White blood cells, they kind of have this search and destroy function. They are kind of the defenders against injury almost, whether that's medical or trauma. They consume bacteria and viruses to combat infections in the body. And then you also have platelets, and they interact with one another and with some other substances in the blood to form clots that help stop bleeding. Now, a pulse. That is the pressure wave generated by the pumping action of the heart. Now, when you're counting the number of pulsations per minute, you also count the number of heartbeats per minute. That's what we're doing. So usually you can feel a patient's radial and carotid pulses. In a conscious patient, you're going to want to remember, we're going to go find the radial or at the wrist, at the pulse, and remember it's at the base of the thumb. So if they appear to be in shock or unconscious, you can try to look for a carotid pulse first. So we mentioned that before, but we're going to put 2 fingers lightly on the larynx and then slide the fingers off to one side until you feel that slight notch on the neck. And then we should be able to feel that carotid pulse around there. So if you can't find it within 3 seconds, then you're going to need to move on. We can move on to trying again, or just move on to another place. So shock, we mentioned it, defined as a failure of the circulatory system. Circulatory failure has many possible causes, but the 3 primary causes are going to be pump, pipe, and fluid loss. Pump failure, pipe failure, fluid loss. Now, cardiogenic shock, that's going to be pump failure. So it's when the heart can't pump enough blood to supply the needs of the body. So it can result, if the heart's been weakened by a heart attack, inadequate pumping of the heart. It can cause blood to back up into the vessels of the lungs, and what that does is result in congestive heart failure, CHF. Remember, we talked about the congestion is not actually in the lungs, the congestion is actually in the pulmonary system. So that congestion backs up into the lungs. Pipe failure caused by the expansion of the capillaries to as much as 3 or 4 times their normal size, because those things are normally not keeping everything nice and tight and keeping everything where it's supposed to be. They dilate to 3 to 4 times their normal size, and that causes fluid shifting. So this causes the blood to pool in the capillaries instead of circulating throughout the system. So when the blood pools in the capillaries, then the rest of the body is deprived of blood, obviously. And what we might see is that the blood pressure can fall, shock results. So blood pressure is the pressure of circulating blood against the walls of the arteries. And I remember we mentioned that earlier as well. But in shock, when we keep talking about shock, it's caused by sudden expansion of those capillaries. Blood pressure can drop so rapidly in patients that you're unable to feel either a radial or a carotid pulse. So 3 types of shock are caused by pipe failure. Shock induced by fainting, so psychogenic shock. Fainting, it's kind of the body's response to a major psychological or emotional stress. So as the nervous system reacts, the capillaries suddenly expand to sometimes 3 to 4 times their normal size. In fainting, that's just a short-term condition. It corrects itself once the patient's placed in a horizontal position. Then we have anaphylactic shock, that was another one, caused by an extreme allergic reaction to a foreign substance. So shock can develop quickly following the exposure. It's an exaggerated reaction by the body that causes this. So the patient may suddenly start to sneeze or itch, develop a rash or hives, experience swelling of the face and tongue. They appear flushed and breathing can become difficult. Blood pressure starts dropping rapidly. And once again, the pulse can be so weak that you may or may not find it. You won't be able to feel it. So the death will result, though, if we don't do something about this. The death can quickly result with this. Then septic shock. So we're talking about some infectious type stuff. Leaky and porous blood vessels dilate due to an overwhelming infection throughout the body and life-threatening emergency. This is typically seen in older adults, although you can certainly see it in babies and younger people as well. But for the most part, we probably see this in the older population. And then spinal shock. So it's also referred to as neurogenic shock. This is typically in patients who have had sustained spinal cord injuries. And what we see is the injury allows those capillaries to expand and blood pools below the level of the injury. So brain, heart, lungs, other vital organs, they're all deprived of blood, which in turn results in shock, which once again starts to be a big problem. So then fluid loss within this. We start talking about fluid loss, and it can be caused by some excessive bleeding. Another word for that, as you see up there, is hemorrhage. It's the most common cause of shock. So blood escapes from the normally closed circulatory system. We kind of mentioned that the circulatory system is this closed circuit. And what happens is that it goes through an internal or an external wound. And then the system's total fluid level drops until the pump can't operate efficiently. It needs a certain amount of fluid and pressure and all of that to work right. So the heart begins to pump faster because it's decreasing in fluid, and it needs to maintain that pressure in those pipes. So as fluid continues to drain out, then the pump eventually stops pumping altogether, and that results, as you're probably aware of, in cardiac arrest. Now, external bleeding is not difficult to detect many times because you can see the blood escaping from the circulatory system. They may be pooling under their back. Who knows where it's escaping from? But it's typically not all that difficult to see when it is external bleeding. Now, with internal bleeding, that can be a little bit harder. Sometimes that can't be seen. But you may see signs of internal blood loss. And what we're saying is bruising, swelling, rigidity, where we talked about the abdominal region, severe pain in that immediate area. Those are all things that you could see with internal bleeding. Now, whether the bleeding is external or internal, if it remains unchecked, then the result will be shock. So eventual pump failure, death after that. So that's one of the biggest things that we hope to do is to be able to recognize these things and get them where they need to go. That's really our number one goal. As a paramedic, it's the same thing. We're talking about from EMR to paramedic. There are several levels in between there. As a paramedic, we don't do surgeries when the thing is that they have a lacerated liver or something like that. We're not doing anything, spectacular on the side of the road with these patients. We're recognizing that they're sick. We're going to do a few little skills differently, and then we're going to get them to where they need to go. So this is, there's not some amazing skill that a paramedic has to fix this patient. It's just that we recognize as well that they need to get out of there and they need to go. So an average adult has about 12 pints or 6 liters of blood circulating in their system. So when we start talking about fluid loss, when we have 2 or more pints or more than 1 liter of blood loss, it can produce shock. So you see on here kind of the potential blood loss from those injuries in various parts of the body. So you see the upper extremity, chest, abdomen, pelvis, all those areas. Now, shock deprives the body of sufficient blood to function normally. It's kind of spoken about shock in a couple of different ways, and essentially it's just low perfusion or low nutrients and oxygen and all that low amount of blood that's getting to the organs. So it's shock deprives the body of sufficient blood to function normally. Now that what the shock does, that's a or a byproduct of that. But as it progresses, body alters its functions in an attempt to maintain sufficient blood supply. So what we see is the heart will start beating faster, trying to maintain cardiac output. It's going to do a lot of last ditch kind of things. So you can see some confusion and agitation, restlessness, anxiety, cold, clammy, sweaty, pale skin. These are all signs and symptoms of patients that are in shock. These as well, and we talked about, rapid weak pulse because the heart is having to speed up, increased capillary refill time, nausea, vomiting, weakness or fainting, thirst. You see a lot of different things. So changes in mental status, that's probably going to be the first signs that we see. So we want to make sure that we're monitoring their overall mental status. That's going to be able to help us detect shock. And then a capillary refill test and, condition of the skin is what we're thinking about. That's going to help you recognize shock in patients who have dark skin. So just the general general treatment for this. What are we going to do about it? So to combat shock, as an EMR, doesn't matter what the cause is, and we want to make sure that we're trying to keep it from getting worse, we're going to do some of these things. So we're going to position the patient correctly. So if the patient has no head injury or extreme discomfort or difficulty breathing, we want to lay them flat on his or her back on a horizontal surface. Then place a blanket under them. Consider elevating their patients if their legs, if that's in your protocol. Sometimes some of this has changed with the Trendelenburg position. Some has changed, some has not. So you may consider elevating the patient's legs. That's Trendelenburg position. If they have a head injury or a spine injury or even a lower extremity injury, you're not going to want to elevate their legs. But if patient's having chest pain or difficulty breathing and no spinal injury, then you can put them in a sitting or semi-reclining position. We're going to maintain the ABCs. We're going to, if we need to, we're going to open the airway, maybe perform rescue breathing in the event that we have to, or maybe even all the way up to begin CPR. Now, just to let you know, in a traumatic situation, traumatic full arrests do not have a good outcome, very often at all. But if possible, we'll treat the cause of shock. So most patients who are in shock, they need to be treated in the hospital. So we're going to be able to treat one common cause of shock as an EMR, and that's going to be that external bleeding that we talked about. So we'll control that external bleeding with some direct pressure, elevation. We may move on to a tourniquet or pressure points, and we're going to talk more about that in lab of how to, if you're unaware of how to put on a tourniquet and do that type of stuff. There's also a video that's made that you'll find in the little LMS in the chapter thing under skills. So we also want to maintain their body temp. A patient with cold, clammy skin, we need to cover them up. So we want to place blankets under them to keep the body heat from escaping into the ground. We do not want to allow them to eat or drink. Patients in shock could be nauseated, and eating or drinking may cause some vomiting. So we don't want that. If they need emergency surgery or something, we want to make sure that they don't have anything in their stomach, at least from us. And if you're working in an area where the ambulance response is more than 20 minutes, you may give a patient a clean cloth or gauze pad that's been soaked in water to suck on, and it's something that all depends upon, where you work and what they want you to do. So assist with other treatment. So when an ALS unit arrives, be ready to assist those personnel with further treatment. So we're talking about when the ambulance arrives. We're just assuming that you guys are the EMR and you're on scene with fire. Well, we're waiting for the ALS, advanced life support. So the paramedics to arrive on scene need to be ready to help. So if you're trained in administration of O2 and you have it available, make sure we're putting this on shock patients. Not basic EMTs, but advanced EMTs and above can start to give some IV fluids. And then depending on what your protocols are, you may look at some anti-shock garments or like I said, just depending on what you do, where you're at. So as soon as you determine that patient's shocked, you need to make sure that an ambulance has been dispatched. They should have already been dispatched, but you need to make sure that they are. Have a clear and concise report for the next oncoming truck. Now, treatment for shock caused by pump failure. So this is going to be obviously a serious condition. Your proper treatment and prompt transport by the ambulance to an appropriate medical facility, that's going to give them the best chance for survival. Remember, there's not much you can do. As a paramedic, we have a few different tools. We can give some certain medicines and do a few little things, but not much. So when the pump is failing, we need to get them to the right place. Now, anaphylactic shock, we're talking about the pipe failure. Patient obviously still needs to be transported as soon as possible, but we can administer some meds. Now, that's where we need to get into with, we need to make sure that we're getting EMTs and paramedics and whoever else you have available there because they have certain medications that they can give. Now, some patients, depending upon who you're running on, they may have some severe allergies and carry an epinephrine auto-injector. If they do, depending upon your local protocols, and you've been trained how to use it, you can assist them using that. That was the thing where we talked about on the outer edge of the thigh that we would use. So we would push that auto-injector firmly against their leg and then hold it in place for a few seconds and then allow that medicine to be transferred into them. Now, treatment for neurogenic shock and then septic shock. We're not changing a lot of things here. So neurogenic or spinal shock, we want to keep the spine in the neutral position. We want to do ABC, so general supportive care, right? We want to treat the symptoms of shock and arrange for transport, obviously. So whether that means oxygen, whether that means keeping them warm, all of those things. Same kind of thing for septic. We're going to do the same thing. So we're going to general supportive care. We're going to keep them warm. We're going to give them some O2. And then fluid loss. So treatment for shock caused by fluid loss. Now, if it's internal loss, important to recognize those early symptoms that we've mentioned and symptoms of internal bleeding. So if you're treating several injured patients, those with internal bleeding should be transported first because immediate surgery may be needed. So bleeding from the stomach, ulcers, ruptured blood vessels, tumors, that can cause internal bleeding and shock. We're not just talking about, obviously we're talking about trauma, but some of that stuff gets mixed in also with medical. But this bleeding, it can be spontaneous, it can be massive, and it can be rapid. And some of that stuff can actually come up, and you'll know that there's some bleeding going on in there. So in addition to the classic signs of shock, this internal bleeding, it can show us a few other things, in that coughing or vomiting blood, abdominal tenderness, rectal bleeding, vaginal bleeding, and then just those classic signs of shock that we talked about. So restlessness and agitation and anxiety and low blood pressure and high pulse and all of that stuff also. So when we talk about trauma, we see that we have some different kinds of blood loss. We have 3 separate types, and as you see in your pictures, A is going to be capillary, just that little paper cut. B is going to be venous, and we'll talk about each one of these. And then C is going to be arterial, which is going to be the one that kind of can become a bit of a problem. So capillary, most common type of external blood loss. It's just the thing, it just oozes out. It can be controlled simply by applying direct pressure to the injury site. Now, venous bleeding, second most common type of bleeding, has a steady flow, so it just kind of comes on out. Apply direct pressure for a few minutes. It tells you 5 minutes. Apply some direct pressure for several minutes, and typically it's going to take care of things, unless, how we talked about, if people are on blood thinners or if they have some clotting issues. But let's get on to arterial. So that's our most serious type of bleeding. Arterial blood spurts or surges with every heartbeat. So unchecked arterial bleeding can obviously result in death because it's a loss of blood in such a short time. So we need to make sure that we're putting on direct pressure and maintain pressure on the site until EMS arrives. You may need to put a tourniquet on that, or you may need to elevate it, all depending upon how serious this is and how you're able to control it. Here's a picture of some direct pressure. Place a dry, sterile dressing directly on the wound and then press with that gloved hand. Once again, it's a gloved hand, right? Wrap the dressing and wound snugly with roller gauze to maintain direct pressure. Now, don't remove a dressing after you've applied it, even if it's soaked with blood. Sometimes people might want to do is remove that one to put a new one on it. Well, you can easily yank off a clot or, just cause more damage. Don't do that. Just put another one on top of it and then wrap it in place. So, elevation. Things aren't getting any better. So if direct pressure doesn't stop the external bleeding from an extremity, we want to elevate the injured arm or leg as you maintain direct pressure. Then tourniquets. So tourniquets is indicated only in situations where extremity bleeding cannot be controlled by direct pressure or elevation, which is what we've done up to this point. Now, high velocity wounds and explosive devices obviously can sever arteries in arms or legs, and that's how tourniquets came back into the streets, is because these were used very effectively overseas in combat, and many lives were saved with this, and we were able to put these back on kind of on the streets. So to reduce deaths from these type of wounds, the military has developed and adopted several more modern versions of these tourniquets. So it can be applied and left in place up to 2 hours without causing significant damage to the affected limb. Now, if tourniquets only if you've completed proper instruction. If you don't know how to use them, then you probably shouldn't put them on. But, you want to make sure you're using them properly, as well as one thing that I can tell you that's, it seems like this would be a very basic tool for us to use, but they've determined that even as a professional, let's say professional rescuer, an EMT, a trained EMT, people are not applying tourniquets properly. What I've seen and what I believe is when people are ratcheting them down or tightening them up, the patient obviously is going to yell because it's getting really tight and it's right near their injury site. And that causes someone to stop right there. Well, unfortunately, we have to go a little bit farther more times than not. Usually when someone, yells and tells you that it hurts really bad, we need to go a turn a little bit. We need to turn it 1 or 2 more times. So we have to turn it, we have to tighten it until we stop all of that blood loss. Hemostatic agents. So they're developed for the military, provide some rapid clotting if it's used properly. Those things are usually impregnated in gauze dressing, or it can be supplied as a powder. You can pack these agents into a wound to rapidly aid in the formation of a blood clot. They're useful for extremity wounds and then even junctional areas, so groin, shoulder, armpit, neck, where a tourniquet can't be applied. All right, I think we'll shut this down here and pick up where we left off in the next one.